This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, February 3rd, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Medication Availability for Alcohol Use Disorder in Substance Use Disorder Treatment Facilities. This study examined the availability of MAUD in SUD treatment facilities, or SUDTF, from 2017 to 2023. Data were obtained from SAMSA's Mental Health and Addiction Treatment Tracking Repository. The percentage of counties with an SUDTF offering MAUD increased from 34% in 2017 to 50% in 2021. This increase leveled out between 2021 and 2023, perhaps related to the pandemic. Counties with MAUD offering facilities were more likely to be metropolitan, with substantially more population and fewer uninsured residents. The authors call for policies supporting MAUD offering facilities, particularly in underserved counties. Next is an article in Addiction titled Comparing the Accuracy of Artificial Intelligence Models to Detect Alcohol in Video Images. The advent of smartphones, social media, and streaming platforms has made it difficult to track depictions of alcohol and alcohol use in videos. In addition, there's evidence of a link between viewing depictions of alcohol and its consumption, and that streaming platforms contain more depictions of alcohol than traditional media. Given these circumstances, researchers tested 3 artificial intelligence models and their ability to accurately identify depictions of alcohol in various media. Researchers found that the zero-shot learning large language and vision assistant model worked well and provides a potential way to track depictions of alcohol in media, thus informing public health interventions. Our next article is in the Addiction Biology and is titled Neural Response to Theta Burst Stimulation Predicts Long-Term Relapse in Patients with Alcohol Use Disorder, a pilot fMRI study. This study measured the effect on AUD recovery of continuous theta burst stimulation, or CTBS, a form of transcranial magnetic stimulation where pulses are delivered at theta rhythm. Participants received 10 CTBS or sham treatments over 2 weeks. Neural activation provoked by alcohol cues was measured before and after CTBS treatment using fMRI. The active CTBS group showed reduced relapse risk over the following year. The sham group had a progressive increase in alcohol cue reactivity after sham treatment that was not seen in the active group. The authors suggest that in early abstinence, the brain becomes increasingly sensitized to alcohol cues and that this was suppressed by the CTBS treatment. The change in neural activation was able to predict relapse in 79% of patients. The authors conclude that CTBS treatment reduced risk of relapse by reducing craving-related neural activity. Next is an article in Journal of General Internal Medicine and is titled Impact of Medication for Opioid Use Disorder on Patient-Directed Discharge Among Patients with Opioid Use Disorder. This New York-based retrospective study compared outcomes for inpatients with a diagnosis of OUD who received MOUD to those who did not receive MOUD, with a primary outcome of patient-directed discharge. Admissions of patients with OUD who were not on MOUD prior to admission were included in the study, which took place from January 2016 to December 2022. Researchers found that admissions receiving inpatient MOUD were significantly less likely to result in a patient-directed discharge. Additionally, admissions receiving MOUD were significantly more likely to receive a discharge prescription for buprenorphine, as well as a buprenorphine prescription within 60 days of hospital discharge. Next is an article in JAMA Network Open titled Mobile Telemedicine for Treating Chronic Hepatitis C Among Rural People Who Inject Drugs, a Randomized Clinical Trial. This open-label, randomized parallel group clinical trial compared mobile telemedicine for hepatitis C treatment with enhanced usual care. The trial ran from April 2022 to September 2024 in rural counties of New Hampshire and Vermont. Participants were randomized to either mobile telemedicine care, or MTC, which brought HCV treatment directly to patients via mobile van, or enhanced usual care, in which a mobile team provided care navigation and referral to an HCV treatment provider. Both groups received sterile syringes and other harm reduction services. Participants in the MTC arm had higher rates of treatment initiation and higher rates of viral clearance at 12 weeks. Our next article is in the Journal of Addiction Medicine and is titled A Long-Acting Naltrexone Implant, or iSTEP-N, for Opioid Use Disorder, First in Human Phase 1 Trial. iSTEP-N is a novel bioresorbable subcutaneous implant designed to release naltrexone for 6 to 12 months after a single procedure and improve adherence. This single-center, randomized, double-blind, placebo-controlled, single ascending dose trial was also a first-in-human study which evaluated the safety and pharmacokinetics of iSTEP-N. At the 9.6 gram dose, iSTEP-N provided sustained therapeutic naltrexone exposure for 12 weeks with a favorable safety profile, while releasing less than 1/4 of its drug content. Further studies will evaluate long-term exposure, safety, and clinical feasibility in individuals with opioid use disorder. Next is an article also in the Journal of Addiction Medicine and is titled Benzodiazepine Tapering, a Marathon, Not a Sprint. While benzodiazepines can have benefits, they also carry risks, including dependence, withdrawal, including protracted withdrawal, and benzodiazepine use disorder. In this commentary, the authors discuss the core of recent guidelines of benzodiazepine use and tapering, noting risks and benefits should be discussed with each new prescription, tapering should be patient-centered, and because response can vary significantly between patients, should start slow. The authors also highlight other considerations, including benzodiazepine use in persons with substance use disorders, co-occurring psychiatric conditions, and transitioning to long-acting benzodiazepines. Finally, the authors highlight some of the research gaps, including strategies to prevent and treat protracted withdrawal, valid withdrawal scales, and long-term outcomes if phenobarbital is used for tapering. Our final article is in JAMA Network Open and is titled Standardizing Opioid Treatment Program Performance in the Era of Medicaid Reform. This invited commentary reviewed a national cohort study from Delisle and colleagues which analyzed over 500,000 methadone treatment episodes across more than 1,300 opioid treatment programs using Medicaid data from 2018 to 2023. The author developed an adjusted retention metric at 30, 90, and 180 days, revealing significant variation in patient retention even after accounting for case mix. This reliable, scalable measure offers a foundation for evaluating program performances, informing quality improvement, and advancing equity in opioid use disorder care, underscoring retention as a key indicator of treatment success and system accountability. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.